Once upon a time, the ever-bustling city of Lagos got a rude awakening. That day would incidentally thrust an entire nation off the sidelines into the full reality of play.
On the 27th of February, a 44-year-old gentleman, a national of Italy, was diagnosed with COVID-19 in Lagos State. It is the first recorded in Nigeria since the first confirmed case was reported in China in January 2020. He arrived at Murtala Mohammed Airport at 10 p.m. on the 24th of February, going to the 25th, aboard an airline that stopped over in Istanbul. He was on the way to his company in Ogun State and spent the night of arrival in Ikeja before proceeding to Ogun on the 25th of February. On the 26th, he presented at the staff clinic of the company in Ogun State, and the doctor who attended to him probably did a malaria test, but we commend his high index of suspicion when he began to have doubts about the diagnosis he was thinking about, and referred this gentleman to the infectious disease hospital in Lagos. And that same night, the night going into the 27th, he was diagnosed positive with COVID-19.
But before then, there was this. A meeting which took place nearly 4 weeks before Nigeria's coronavirus index case. An InterMinisterial Forum which recognized the imperative for a workable preparedness and response plan which laid out the modalities for achieving targeted results. This multi-sectoral coronavirus preparedness group was constituted with representatives from the World Health Organization, the Office of the National Security Advisor, and the United States Center for Disease Control. Representatives were also drawn from Public Health England, ProHealth International PHI, and the country's coordinating agency for infectious disease control, the Nigeria Center for Disease Control, NCDC. The meeting reaffirmed that the 22 existing public health emergency operation centers in the country had been placed on alert. It also reviewed the setting up of a toll-free line for inquiries and confirmed the acquisition of an in-country coronavirus testing system with the help of the WHO. At that time, the forum concurred with the decision to issue a travel advisory against non-essential travel to China and the suspension of issuance of new visas to persons wishing to visit Nigeria from China. In retrospect, the window of opportunity to prepare may have seemed short, but putting a plan in place is neither a waste nor truly late.
Prevention, they say, is better and cheaper than cure. The security agencies can attest to the fact that the best time to plan for war is before the war. There is a raging war on the global health landscape, and so we must plan. As we all know, the solutions cannot just be from within. It can also, we have to evolve without the health sector.
The ensuing collaborative engagement will not be effective without the support of state governments, particularly those states hosting international points of entry. They are all represented here today, I'm pleased to note. Our ministry is finalizing plans with the Enugu, Lagos, Kano, Rivers states and FCT authorities to enhance surveillance, preparedness and response activities in their states.
But I think it is the last part of Honorable Minister's speech that is quite germane to me, which is the public advocacy and public enlightenment. I think we need to enlighten our people, and I'm glad that the Honorable Minister has also reassured Nigeria that there's no need to panic. But I think they need to take these basic measures which he has, enumerated.
The mechanics of a response plan was clearly in play prior to the importation of the index coronavirus case into Nigeria. But as events unfolded, so did the workings of Nigeria's national response plan. President Muhammadu Buhari gave further push to the national response plan by constituting a presidential task force on COVID-19. Headed by the Secretary to the Government of the Federation with membership comprising heads of relevant ministries, the task force was given a 6-month timeline to carry out a mandate with clearly defined objectives.
One is to strengthen the national response strategy, particularly in the areas of testing, containment, and the management of COVID-19. Two, strengthen collaboration with all tiers of government, private sector, faith-based organizations, civil societies, donors, and partners. And three, build awareness among the populace. And four, direct the deployment of any relevant national asset when necessary. Five, lay a foundation for scientific and medical research to address all emerging infectious diseases. And six, advise government on the declaration of national emergency as part of the containment measures when necessary. We are, however, expected to report on a regular basis to Mr. President in order to give the activities of the task force proper focus. Mr. President has also approved the appointment of a national coordinator who will manage the daily process in collaboration with existing institutions and structures. The national coordinator will be responsible for cohesion and efficiency in the roles played by the different agencies operating in the treatment of the national response strategy. Given the foregoing, therefore, the membership of the Presidential Task Force has been carefully selected as follows. The Secretary to the Government of the Federation will chair the task force. Other members are the Honorable Minister of Health, the Honorable Minister of Foreign Affairs, the Honorable Minister of Interior, the Honorable Minister of Aviation, the Honorable Minister of Humanitarian Affairs, Disaster Management and Social Development, the Honorable Minister of Education, the Honorable Minister of Information and Culture, the Honorable Minister of State Health, the Honorable Minister of Environment, the Director General, Department of State Services, the Director General, Nigerian Center for Disease Control, and the WHO country representative. And lastly, the National Coordinator, Dr. Sani Aliyu.
The decisions and actions which subsequently ensued in the wake of the coronavirus importation into Nigeria were swift and graduated in phases to respond to unfolding events. For instance, when it was absolutely clear that despite measures already put in place by the port health services at the airports, some persons likely infected but asymptomatic could still pass through undetected. After a crucial meeting, the Presidential Task Force took the lead in bringing Nigerians up to speed on what was to come.
The Presidential Task Force at the end of the meeting announced the ban on all forms of travels by public officers and civil servants until further notice. This morning, we have found it necessary to brief Nigerians on further measures being taken after an assessment of the global situation. They are as follows. One, the federal government of Nigeria is restricting entry into the country for travelers from the following 13 nations: China, Italy, Iran, South Korea, Spain, Japan, France, Germany, Norway, the United States of America, the United Kingdom, Netherlands, and Switzerland. These are all countries with over 1,000 cases domestically. All persons arriving, number two, all persons arriving in Nigeria who might have visited these countries 15 days prior to such arrival will be subjected to supervised self-isolation and testing for 14 days. The federal government is, number three, the federal government is temporarily suspending the issuance of all visas on arrival. Number four, the federal government is also counseling all Nigerians to cancel or postpone all non-essential travels to these countries. And number five, the federal government urges public health authorities of countries with high burden to conduct diligent departure screening of passengers and also endorses travel advisories to their nationals to postpone travels to Nigeria. And fourthly, these restrictions will come into effect from Saturday, 21st of March 2020, and it will last for the following 4 weeks, subject to review as the situation unfolds.
The restrictions also apply to cargo vessels sailing into Nigeria. Only cargo vessels which have been at sea for more than 14 days are now allowed to dock in the ports, after the crew must have been tested and confirmed disease-free by the port health authorities. This 14-day restriction, however, does not apply to vessels carrying oil and gas products, as by their nature there is minimal human contact. The rationale for these travel restrictions is clear: protect against further external exposure and reduce the risk of more imported cases while availing authorities opportunity to put up appropriate infrastructure to cope with suspected and confirmed cases at home. Dealing with contact tracing for confirmed positive cases from state to state was always going to be a huge task. Enormous resources, including personnel, machinery and cash, would be expended by the authorities to rein most of these contacts, and whatever level of success achieved depending on the public's level of participation in the national response plan.
When people come back from anywhere in the world, they land in our 4 airports and then they disperse. And anytime within the next 2 weeks, if they have a fever, we have to collect a sample, get it to a lab, test it, and return it to them and inform the response. That means from Zamfara to Akwa Ibom, from Lokoja to Ilorin, we have to assure a certain quality of this service. So it is not easy, and we need your support to enable us to do this. It is not perfect, but we're improving every day, improving sample collection, improving testing, improving turnaround times.
The constant need to improve on life-saving deliverables when faced with an emergency the scale of a pandemic is not new to Nigeria. The successful containment of the 2014 Ebola epidemic still stands as a testament of the country's penchant to responding to such medical emergencies. It also provides some leverage to build the current campaign against the coronavirus outbreak in Nigeria. Although the situation remains fluid, with the number of confirmed positive cases slowly but steadily on the rise, countermeasures adopted by the federal government, such as the suspension of commuter trains across the country, are expected to help curb interstate spread of the virus. Yet again, there is more. The funding and release of cash backing for the Nigeria Center for Disease Control, NCDC, is another area where the federal government has been applauded.
With regard to NCDC, I want to say first of all that every money, every amount they asked for was granted by federal government immediately. Government didn't waste time at all.
The sum of 5 billion naira was released as special intervention fund to the Nigeria Center for Disease Control, NCDC, to equip, expand and provide personnel, to its facilities and laboratories across the country. But the federal government's biggest cash support so far to any agency or state is the 10 billion naira grant to Lagos State, which remains the epicenter of the COVID-19 outbreak in Nigeria. The grant will enable Lagos increase its capacity to control and contain the outbreak, while also supporting other states with capacity building. With the president being kept in the loop, he is always able to take far-reaching decisions based on technical advice to combat the outbreak in Nigeria.
Fellow Nigerians, from the first signs that coronavirus or COVID-19.
In a nationwide address on Sunday, the 29th of March 2020, President Muhammadu Buhari reaffirmed his administration's unflinching commitment towards fighting coronavirus in Nigeria. He said, quote, "In Nigeria's fight against COVID-19, there is no such thing as an overreaction or an underreaction. It is all about the right reaction by the right agencies and trained experts." End of quote.
This strategy takes international best practices but adopts them to suit our unique local circumstances. Our goal is to ensure all states have the right support and manpower to respond immediately. So far in Lagos and Abuja, we have recruited hundreds of ad hoc staff to man all our call centers and support our tracing and testing efforts. I also requested through the Nigerian Governors Forum for all state governments to nominate doctors and nurses who will be trained by the NCDC and Lagos state government on tactical and operational response to the virus in case it spreads to other states. This training will also include medical representatives from our armed forces, paramilitary and security and intelligence agencies. As a nation, our response must be guided, systematic and professional.
By far, the most dramatic of all the anti-coronavirus measures deployed by the Buhari administration within the period under review is the total shutdown of movement in Lagos, Ogun, and Abuja. Except for businesses and services identified and labeled as essential, other persons and businesses were shut for an initial period of 14 days.
We will use this containment period to identify, trace, and isolate all individuals that have come into contact with confirmed cases. We will ensure the treatment of confirmed cases while restricting further spread to other states.
The economic implication of this move is not lost on the government. Having anticipated some of the economic fallouts with businesses under lock and key and families literally in isolation, the government took steps to provide succor to the most vulnerable.
Although schools are closed, I have instructed the Ministry of Humanitarian Affairs, Disaster Management and Social Development to work with state governments in developing a strategy on how to sustain the school feeding program during this period without compromising our social distancing policies. Furthermore, I have directed that a 3-month repayment moratorium for all trader money, market money, and farmer money loans be implemented with immediate effect. I have also directed that a similar moratorium be given to all federal government-funded loans issued by the Bank of Industry, Bank of Agriculture, and the Nigerian Export-Import Bank. For the most vulnerable in our society, I have directed that the conditional cash transfers for the next 2 months be paid immediately. Our internally displaced persons will also receive 2 months of food rations in the coming weeks.
On a broader scope, fiscal and monetary policy adjustments would capture the new reality. Relevant federal ministries, departments and agencies were already working with the Manufacturers Association of Nigeria, MAN, to ensure unhindered production of essential items such as food, medical and pharmaceutical products.
The CBN is directing all deposit money banks to increase their support to the pharmaceutical and healthcare industries. In addition to the 50 billion soft loans which we announced on Monday to small businesses already, as we said, the CBN will increase its intervention by another 100 billion in loan this year to support health authorities to ensure laboratories, researchers, and innovators work with global scientists to patent and/or produce vaccines and test kits in Nigeria to prepare for any major crisis ahead.
On the grounds, things are bound to get better. Some of these efforts are beginning to bear fruit and attract support and contributions from donors within and outside the country. At the last count, groups like the Nigerian Private Sector Coalition Against COVID-19, made up of business moguls like Aliko Dangote, Abdusamad Rabiu of Boa Group, Femi Otedola, Tony Elumelu, Herbert Wigwe, Shegun Agbaje and Jim Ovia of Zenith Bank have made hefty contributions in cash and logistics. They joined corporate bodies like Access Bank, Guarantee Trust Bank and UBA to contribute 1 billion naira each to the government's coronavirus containment campaign. UBA equally donated the sum of 5 billion naira to Nigeria and Africa. Former Vice President Atiku Abubakar pledged 50 million naira, while First Bank is partnering with government, the United Nations and innovative technological firms to provide e-learning solutions to at least 1 million children under its Keep Them Engaged, Keep Them Safe initiative. The show of goodwill is helping the government scale up the fight against COVID-19. An exercise that is currently on stream is the activation of environmental health desks in the 774 local government areas in the country. These units will help in disinfecting high-risk public places and pursue grassroots advocacy while offering guidance and counseling to people at local community level.
The coronavirus, also known as COVID-19, has been declared by the World Health Organization as a global pandemic. While clinical trials are ongoing for a vaccine and a possible cure, there is no known treatment for the coronavirus. Nigeria has recorded some of these cases, and people are advised to take these preventive measures to keep themselves safe and contain the further spread of the virus. This message is brought to you by the Nigerian Television Authority, NTA.
If this war is to be won, then everyone, not just the government, would have to play their part. The rules are simple. Maintain good personal hygiene, wash your hands regularly with soap, or use an alcohol-based sanitizer. Also maintain and practice social distancing, and most importantly, embrace the will to live.
Every nation in the world is challenged at this time. But we have seen countries where citizens have come together to reduce the spread of the virus. I will therefore implore you again to strictly comply with the guidelines issued and also do your bit to support government and the most vulnerable in our communities.